Hi guys, welcome to reporting a Sirona CBCT scan in Gallileos, part of the Gallileos software from Sirona. This video is just designed to show you how to open the files and to help you to report them. So on the screen in front of you, you will see that we access Windows Explorer and then the media that your file is attached to. Open the file and then open the viewer file, and this will give you a list of programs. Halfway down the program list is a setup file, which is a gold Sirona icon. Double click this and it will open the software in front of you. If you get an info box while this is opening, just click OK. It takes a few minutes to open this, and you can see that the 5 standard viewing windows of a panorama Gallileos viewer become available and open and are then populated with the image. Once the image is entirely loaded up, take time to look at this, and I always start with the top left box, which is the panorama view. This is very similar to a panoramic or OPG view. In all of the boxes there is a small arrow on the top right hand side which will extend these to open them fully. But first of all, orientate the slice of your scan for the panorama. This is the blue line which is accessed in this box window on the right side. Make sure this is positioned in the lingual aspect of your arch and use the icons within that box to get the correct size for the blue line. Press save and it will reorientate the scans. I then enlarge the panoramic view, and with a right click and move of the mouse, I can then enlarge this and have an initial view of the panoramic view to check for pathology and abnormalities. In this scan you can see several on the top right and top left hand side. There's also a socket on the top left. Incidentally, on this scan there are 2 false teeth top left to orientate for possible implant placement. Return back to this and grab the viewer box in Sirona, and you can use this to track all the way through the panoramic. This will then change the views on the bottom left and bottom right, bottom left and bottom central area to show you different 3-dimensional views of the panorama. This is one way of doing that. The other way of doing that is to enlarge the box, right click and tab through with the mouse. You can effectively walk through the cross-sectional screen or the saggital screen by doing this. You should try both of these methods to see which is the best for you to become efficient at reporting. It's then important to tab all the way through the whole complete image to check for possible abnormalities and pathology, and this is where the template for reporting is extremely useful, as it will prompt you to do this. You'll see clearly the abnormalities in the lower left sagittal plane and in the cross-sectional plane in the centre. The lower right does not change generally in this view unless it's changed specifically by you. The top right of the screen is a 3-dimensional screen. You'll see abnormalities in the upper anterior region become visible on the cross-sectional views, including apical areas and the incisors. As we tab towards the right side, you'll begin to see a socket emerging in this area, which is planned for possible implant placement with a false prosthetic tooth beneath to orientate an implant. I've enlarged the screen here, and then I will use some of the tabs on the right to look at different functionality here, including changing the contrast and brightness of the scan to outline the socket. I will also click on the ruler icon to allow me to measure both vertically and horizontally. One click, then a second click will give you a vertical or horizontal measurement. When you're finished with this, right click the line and click the remove box. You can also use this to measure horizontally to ensure that you're happy for implant placement to be carried out. In viewer software, it's not possible to place implants. This is something which has to be bought from the manufacturer. There is a multi-measurement line, which will measure between multiple different dots of different angles, and double-click this when you've finished measuring. You can then right-click to remove. There is an angle calculation, which again can be used and takes a little bit of practice in Sirona, but will give you the possible options for angles within the scan and allow you to orientate implants and abutments prior to surgery. We've now finished with this box in this area. We'll complete the rest of the view in panorama to make sure there's no obvious abnormalities and note our findings. The next view you can look at is the MPR view. This is the multiplanar radiography view, which is the truest slice. It is extremely effective at posterior mandible and posterior maxilla and is the most accurate measurement above an inferior dental canal or below a sinus. On the 3-dimensional view or the 3-dimensional recon that I've highlighted here, you can see the slice lines are MPR visible. This will orientate you as to what you're looking at. It's also a great tool to show patients as they are quite interested to see the three-dimensional reconstruction views. Coming out of this, you can orientate this back using the head with the arrows. These will orientate the 3D view in any line you wish. In the lower left box, the true MPR view is visible in the coronal section. You can right click this and click through. You'll see the orange line on the 3D recon moving as you do this. This shows you where the scan is orientated. On the upper right, you can see a thickening of the sinus membrane. In this case, I transfer to the sagittal section to tab through this to see the nature of the thickening and to report upon that. Doing this will also show me the anatomy of the internal aspects of the nose. Once I've viewed that and made my decisions on the pathological elements of that, I can tab through the whole of the MPR coronal view. It's an excellent way to view sinuses and inferior dental canals. When you reach the anterior region, it becomes a little bit more difficult to interpret due to the crossover because of the nature of the curve of the anterior region, but is still useful in many cases, particularly trauma cases. There is also an implant align box. If implants have been placed in the scan, this will align the whole scan around the implants, which is an extremely useful planning tool. On the right side, there's various other tabs which may be filled, including inferior dental canal tracing, CAD-CAM, implant tabs, and reporting.